everyone, and welcome back to the Collaborating Docs YouTube channel. I'm Amanda Guarnierer, a nurse practitioner and the Director of Growth here at Collaborating Docs, and I'm very excited to be joined today by our guest, Dr. Geoffrey Talis, who is one of the founders of Jumpstart Psych. So Dr. Talis is a psychiatrist, and we are going to be diving into some really exciting topics that will hopefully help you if you are a mental health provider add value to your clients and to your practice through a few different innovative solutions. So Dr. Talis, thank you so much for being with us. I'd love for you to introduce yourself a little bit. I obviously know who you are, but for the benefit of our viewers, give us a little bit introduction about kind of who you are and kind of how you got to this place.
Yeah, thank you for having me, Amanda. So I'm Dr. Geoffrey Talis, and I'm an integrative psychiatrist and psychotherapist. I've owned my own private practice already for a little over 2 years now, and have spent many years in medical education and in residency, really focused on how to deliver low-tech, high-touch interventions for my patients so that they get better, faster, and with the least amount of effort. So I gravitated towards psychotherapy as an intervention pretty early on, and I didn't even know it was called psychotherapy at the time. I just knew that there was something between a healthcare provider and a patient, or really just between two people, that one person can help the other person feel better and experience life in a different way that actually has physical benefits. So I was really drawn to this idea of what the mind is and what the body is. And really what I've learned is that they're both the same thing, believe it or not. A lot of people believe that the mind and the body are separate, but really it's together. A simple question to demonstrate this is asking anyone really, where is your mind? How do you describe a gut feeling, or something that's like gut wrenching, or the tightness that you feel in your chest when you're feeling worried or even excited, or butterflies. These are all emotions, and they're tied to thoughts. So it's a far more complicated and complex process to appreciate, and also to use for our patients' benefits when we're sitting with them in session as we treat them. So I think that's how I got here. I discovered psychiatry in medical school, and I felt that it was the best fit for me because it really combined these elements of the body and communicating with patients in a therapeutic way, which ended up being, through prescribing medications to alter the body's physiology, reviewing lab work to identify any potential issues or barriers to optimal health, and treating those as needed, and then also incorporating psychotherapy at the same time. So, and it's been really great so far. My co-founder, Dr. Doug Opler, and I, we started Jumpstart Psych because we both really enjoyed teaching medical students, nurse practitioners, and residents on the consultation liaison service at Rutgers University. And we just had such a good time doing it. And me leaving residency inevitably meant that we may not be able to do that anymore. So that's why we decided to create Jumpstart Psych. And inherently in the name, it's to really just jumpstart people's experience in offering different psychiatry and psychotherapy methods and techniques into clinical practice, no matter what specialty you are. And we do that through a psychotherapy essentials track to our Jumpstart Psych Fellowship, and we're developing a psychopharmacology track to the Jumpstart Psych Fellowship as well. So stay tuned for that. And so what we do is we take everything that we've learned through our medical training, and we offer it through a a curriculum that just focuses on the high yield and practical elements of all of the things that we teach. And we teach strictly to clinical practice. So you get none of the extra fluff or nonsense that you would get in university programs. So we just get straight to business, and people have felt more comfortable and confident offering different psychotherapy and psychopharmacology techniques in their practice to their patients so that they get better faster and patients come back to see them more often.
Well, I thank you for that intro. I think it's a really good way to set the stage for what we're talking about, because, I love how you identified early on, that the mind and the body are one. And maybe we'll touch on this, but I feel like in medical education, in nursing education, in kind of mental health education in general, it seems like things are bucketed into, med management or psychotherapy or counseling or other sorts of interventions within the world of training for providers. But what happens on the patient side of things, I'm not sure the patient understands or expects that, right? Like the patient just has one goal. They want to feel better. They're struggling with something. They want to achieve that outcome of being better. And, it lends the question, are we doing them a disservice by fracturing the approach, right? So it sounds like that's something that you identified as a potential problem that you are helping providers solve. And maybe I'm biased because I'm in the world of nursing, but I think that, the nursing model and the nursing method is such a great foundation for this integrated approach to mental health, because, our nursing education is so foundationally rooted in, helping the person at their core, helping the whole person. So mental health NPs in particular, I think, are really well positioned to have this approach. And it sounds like you agree.
Yeah, no, I definitely agree. And actually, what so many talking points come to mind. I definitely think that the nursing model is it lends itself perfectly to integrating the mind and the body. I mean, even being a patient myself in a hospital setting or in an outpatient setting, my experiences with nurses have always been far more enjoyable than my experiences with my doctor sometimes. So there's something inherent in the practice of nursing that lends itself very well to connecting with people, which I appreciate very much. And something very surprising, you mentioned training for nurses or nurse practitioners. Specifically, I'll speak on behalf of the nurse practitioners that are in psychiatry and mental health that I've been speaking with. I mean, I already lost track of how many I've spoken to over the past couple years since starting Jumpstart Psych. But what I've learned that across the board, PMHNPs that I've spoken with who want to learn more about the psychotherapy essentials track that we have all told me across the board that their training in psychotherapy in nurse practitioner school was so minimal. It was almost like a college level introductory course, like this is what psychotherapy is, and we're going to quiz you on it. So, just know that dialectical behavior therapy is indicated for people with borderline personality disorder, and just understand what the definitions are of CBT and supportive psychotherapy, and you're good to go. So there's almost, and not to mention the heterogeneity among programs and offering opportunities and exposure for PMHNPs to even see what psychotherapy is like in a clinical setting. And also on top of that, how psychotherapy can be combined with prescribing medications to achieve the optimal results. I think most people have heard the saying or just the idea, and can likely appreciate the idea for what it is that a combination of taking medication and being engaged in some type of psychotherapy generally leads to the best results for for people seeking relief from their psychiatric needs. It just seems to make most sense. And this is really even highlighted more recently with psilocybin and MDMA being used in conjunction with psychotherapy. So the psychedelic-assisted psychotherapy movement, also known as the medication-assisted psychotherapy. This concept isn't very new. And actually, for many years over through the 20th century, physicians and psychiatrists have been using medications even during World War II when working with shell shock and what we now know as PTSD, using medications even as early as then in conjunction with psychotherapy to facilitate healing from trauma. And so SSRIs and even propranolol could be used alongside psychotherapy to enhance the psychotherapeutic process by reducing the amount of resistance that your patients can have when discussing difficult situations or circumstances that they've experienced or been in at some point in their life, and sometimes processing them can help them work through that experience that somehow is stuck within the body and causes a lot of distress.
I think that it brings up kind of a transition point of like, it sounds like we agree, and hopefully our viewers agree, that the best thing for our mental health patients is this combination, pretty much regardless of what the diagnosis is. That combo of med management plus psychotherapy is certainly not going to hurt, and in most cases it's likely going to improve those outcomes. So maybe someone watching, I'm guessing someone watching who's a mental health NP, for example, who may have been nodding their head when you said, it's a very kind of rudimentary training in their NP program when it comes to psychotherapy. Like, where do they go from here to get started? And I'm not sure which we should talk about first, so I'll kind of let you decide there. Like, I know that there are benefits to my patient. I get that. But I also, if I'm a business owner, I also want to know, are there benefits to my business? And how am I measuring the return on my investment in learning this new skill, both on the clinical side and the business side? So I'm hoping you can kind of decide which path to go down there so that we can take a deeper dive.
Yeah. So, and I think we'll get to both of those things. So I think it's kind of important to understand why it is that training in psychiatry has really focused predominantly on medications first, and the reason for that is business related, actually. So what happens when healthcare organizations and even small private practices are in network, for example, insurance companies really dictate how much each service code, like an ICD code, is not ICD, the CPT codes are valued at. So for like a follow-up visit could be valued at $100 or $175 or even less, even $80, depending on the code. So there's a specific number amount, and that's determined by the insurance company. So when the insurance company lowers the rates for certain billing codes, then practitioners in any medical specialty or healthcare specialty is impacted, in that if you're making less money per billing code, then you need to see more people in order to make up for that loss. And what happens when you're pressured and incentivized even to see more people in your practice, you inevitably have less time during the day to spend with your patients to really get to know them. And so the part of the downside of psychotherapy sometimes is feasibly not having enough time with your patient to facilitate that deeper level of change that maybe is something that they're looking for or something that you've identified that they need. So that definitely is a challenge. Plus, and especially upon nurse practitioners, I know a lot of early career nurse practitioners go into once they get out of school, they take a job and they find that they're seeing 20 to 30 patients in a single day, and they hardly even know their patients. And sometimes they're just kicking the can, which is no fault of their own. Oh, this patient's been prescribed Zoloft for anxiety. Well, I'm just going to continue prescribing this until it doesn't work, and then I'll figure out what to do, because in another 10 minutes, I have another person I need to see that I may not even have enough time to get the information I need from them anyway. So, so healthcare organizations are responsible and also incentivized to load up practitioner schedules to a maximum where it doesn't really offer much of this connecting time between them and the patient, which then leads to a split treatment model where patients will then receive psychotherapy from another type of practitioner, such as an LCSW or a psychologist, which objectively they've had far more training in psychotherapy than the nurse practitioner themselves. And much of what I'm saying also applies to psychiatrists as well. So when I say nurse practitioner or psychiatrist, there's functionally, psychiatrists can also be overloaded in a job that they take as well. So there's a lot of overlaps and similarities between the job responsibilities. And then to be able to fulfill those responsibilities is another thing. So what if a nurse practitioner understands that psychotherapy is important? They've already graduated from their program, and they could be in a high volume setting, or maybe they got lucky and they were able to get a supportive work environment that also provides some level of education, but maybe not all of the psychotherapy training that they're looking for. There are various psychotherapy training companies out there. Just off the top of my head, there's the Beck Institute, which is really known for cognitive behavioral therapy education. And I'm sure with a quick Google search, you can find other top names for any other psychotherapy you'd like to learn about. Something that my co-founder, Dr. Opler, and we identified that there's really not much in the way of educating practitioners in medicine or psychiatry to offer psychotherapy as a service. Because when you're prescribing medications, there's another variable that's brought into the therapeutic relationship, and that's the medication. And people can have relationships to medications as they can have relationships to people. That people can be really drawn to medications and really identify with, oh, I just love Xanax. I need to have Xanax. And now in their mind, whether it's because they're chemically addicted or because or it could be a psychological dependence on it, there's still a relationship there. And so that variable, I think, many therapists don't necessarily aren't really at the forefront of necessarily managing that. And so there was an incentive for us to create an education program specifically geared towards nurse practitioners, psychiatrists, and other healthcare professionals who manage patients in a medical type setting to offer psychotherapy. So say you go to the Beck Institute. Well, the Beck Institute, although they have CBT training, it's geared mostly towards therapists rather than prescribers. And I'm using prescribers as a general term, not to minimize anyone's role. I'm a prescriber. I prescribe medications. So we created Jumpstart Psych and the Psychotherapy Essentials track in order to address the need of being able to have access to multiple different modalities of psychotherapies without needing to take a specific program that's set out to only teach you CBT for a year or 2 years. So we cover everything in a month. So each modality that we cover everything in a month, everything in our fellowship track, that is. No one's necessarily going to be an expert if they enroll in our program. They're not going to be an expert in any one of the modalities, but as our name suggests, it's going to help you feel very comfortable and confident to be able to use the high yield and practical skills that we focus on, so that you're not feeling lost and you actually get a flavor for what it is that you're practicing and what you're offering to people, and see what fits best for you. So it's essentially like an appetizer sampler. You get a little bit of everything, and then you say, well, the sliders were really great. I think I'm actually just going to order the entire burger next time. So the Psychotherapy Essentials track is a really good jumping point for anyone who really who thinks that they want to do a really in-depth psychotherapy program, but doesn't know where to start. I think I covered a lot there. I'm not sure if I missed anything.
Yeah, no, that's super great. That's very helpful. And I guess I'm wondering, I mean, I have I'm not a psych NP, but I have a bit of an understanding, when it comes to the business side of things. And I'm wondering if you could speak a little bit to, you talked about CPT codes. My understanding is that if you are doing med management and psychotherapy, you can bill for those in the same visit, thus justifying having a longer visit and a higher reimbursed visit if you are taking insurance. So could you speak to that a little bit? And also, for those who have a self-pay practice, how are they going to advertise themselves a little bit
Yeah,
different?
great. So the business component. So the business component that is really important for nurse practitioners and really any healthcare practitioner to know is the number of codes that you bill for. That's the number of services that you're, number one, providing, but number two, that you're going to be paid for. So if you're offering two services, say you're doing medication management and psychotherapy in one visit, well, you're billing for two codes. So for that one visit that, for say an early career nurse practitioner with no psychotherapy experience can't quite bill for a psychotherapy code if they don't know they're doing psychotherapy. That just wouldn't be ethical. So, when doing medication management visits, those visits are on average maybe once every other week or once a month or even once every 3 months. So what happens when you begin to offer psychotherapy and you begin to become, when you actually become proficient in offering psychotherapy as a service, you'll notice and you'll likely recommend to your patients that they come back on a more frequent basis, even on a weekly basis or even twice weekly basis, depending on the work that you're doing with them. So, and at each of my visits, I'm assessing sleep, mood, appetite, anxiety, other behavioral habits, and I'm asking myself at each session, is this medication regimen still effective for this patient? Why or why not? Are they just having a bad day? Are they just having a good day? Or is anything that they're experiencing unusual, something that needs to be attended to with my assistance? So you're seeing a patient for 2 billing codes once a week versus once a month. You're essentially, if you do just the simple math, you're essentially multiplying your income at least by 4 times, at minimum by 4 times. So, and also in addition to that, and this applies whether you're in network or out of network, self-pay or insurance-based, the number of times that someone's coming to see you for their service is just how many times they're going to be paying you and how much your practice is going to be generating in a single month. And the number of patients that you're seeing are going to be reduced. So now you're going to be, in addition to an increased frequency of visits, you also have a smaller patient panel, so you can really even focus more. You're not burdened by having a ton of other people that you're seeing. You're actually keeping your practice small and keeping it manageable. So now you're really getting to know each patient that you're seeing on a weekly basis. You're making at least 4 times your income. And so you're able to spend that time with people to really get to know them and make sure that the medications you're prescribing are effective and the psychotherapy interventions that you're doing are effective as well.
Yeah, I love that. I think, especially if anyone is watching who is maybe an NP already in the more medical side of the house and you're thinking about mental health, um, especially for folks who want to have their own practice and have more autonomy over their schedule and things like that. Um, it's hitting me. The biggest struggle that we see for more medically focused providers who have their own practice is actually filling that patient panel because if I'm an FNP and I'm taking on fairly healthy folks or folks who maybe have 1 or 2 chronic illnesses, like half my panel could be people who I only see once a year for a physical, and then maybe urgently if they get sick, or for more stable people with chronic illness, like I may be seeing them once every 3 to 4 months for med checks or med refills, depending, right? So from the business owner perspective, I'm spending a lot more time focused on patient acquisition if I'm on the medical side of the house or even, med management without psychotherapy, because to your point, if I'm on the mental health side of the house and I need fewer patients to be full, not only am I forming deeper relationships with them, but then from a business perspective, I'm not spending a quarter to half my time focused on marketing because I need to find new patients. Um, so it
Right, so you can actually focus on the thing that you went to school for, that you
right,
are really passionate about, which is you're focusing on patient care rather than running a business as much. I mean,
right.
there's still business management, like administrative burden you're going to take on when you have your own practice, but it's going to be far less when you have a smaller patient panel that's more manageable and you're getting to know everyone. You're just going to enjoy your work even more.
Yeah. I'm going to put on my patient slash mom hat for a moment. So one of my kiddos has ADHD and anxiety, and she's medicated, and we also have her in psychotherapy. She goes to the talking doctor, as she calls it, every other week. And they're different people because one person is a counselor and the other person is a physician. So, people who are watching may not be psych NPs, but may be consumers or patients or parents. So my question for you is, how do I, as a consumer of healthcare, find a provider like yourself or the ones you are training? Because it seems that this is the method by which mental health care should be delivered, but because of how the system is set up, like I'm going to be digging to try to find someone who can be that one-stop shop for either myself or my loved one.
Yeah, great question. I have to say that many of the people that are seeking care out with me all tell me that it's so difficult to get someone on the phone to even call them back for an appointment. Um, and that could be for a variety of reasons. I mean, number one, a lot of in-network practices are very full with people coming to see them for very basic care, like a medication prescription. It could be that the systems in place for those businesses don't offer good support with patient contact. That could be entirely true. But certainly for in-network providers to work with someone who does therapy and medication management simultaneously in network is actually very, very difficult. And you're more likely to find that in a cash pay practice because cash pay practices don't rely on insurance companies for payment. And so it's really based on, I mean, your zip code really matters as it relates to payment, and also availability of practitioners in your area, which is another barrier. But what I've heard and what I've seen is that it's very difficult to find people that do both. There has been more reports and literature that's being put out there, especially in the Psychiatric Times. There was an article in the January 2024 issue talking specifically about the decline of psychotherapy practice in psychiatry in favor of medications, and citing the barriers that we discussed, which is insurance companies incentivizing higher volume over longer session times and lower reimbursements. So consumers in psychiatry, I would say it is very hard. And one way that you can really know if someone is right for you and someone that does both medication management and psychotherapy is by viewing their website, looking at the type of training that they have or the services that they offer, and even submitting an inquiry asking, hey, I'm really looking for someone that can help me with X, Y, and Z, and I'm really interested in seeing someone that can do both medication management and psychotherapy. Are you the right person for me? And that can just start the discussion. So, and whether or not that's clearly identified on any practitioner's website, it's something that you can certainly ask. What is your training in psychotherapy? Can you help me with this issue? I really need to talk to someone professionally about this. I've tried all of these things and they haven't worked. I think I need to do this. So just be open about what it is that you're looking for, and don't shy away from it. And if they say, it's really not my niche, it's not really what I'm great at, so I'd recommend you look here, here, and here, and this is the ways that I can help you. It could even be a starting point for you to discover or even receive any referrals or recommendations from them. If they're a psychiatrist or nurse practitioner who work closely with a therapist, or maybe they have one in their practice, they can describe to you the benefits of the split treatment model and help you better understand that you're going to be taken well care of in both of these aspects and under the same roof, not necessarily the same person.
Mm.
Is that helpful to learn?
Yeah, it's helpful, and it also just underscores, if you are a practitioner or provider, how important it is to have some sort of online presence and to really make your messaging clear, because that is how so many people are going to potentially find you and decide whether even to reach out to you. So I think that's a good kind of reverse engineered lesson on the importance of making your messaging super clear so that you can really attract the people who are looking for a provider like you, because they're certainly out there. They're just stuck on the phone trying to find where you are because they're calling all different people.
Yeah.
So
And actually patients are really actually asking a lot more. I've heard never have I heard so frequently just within the past year how many patients are actually looking for providers who actually offer therapy and medication management together, because people just don't want to see so many people at once for the same issue. They really want to get to know one person and have that one person be their go-to. So people are looking for this more and more often, and I've heard nurse practitioners tell me how they had to turn patients away because they say, well, I'm not the person to do psychotherapy with you. It's not my specialty. You should go see a therapist for that. And they're in an area that's underserved and there aren't really any therapists available. So then what are you supposed to do then?
Right. Well, as we wrap up, please tell the good viewers and listeners all the places where they can find you and work with you and learn more about the Jumpstart Psych program. I think that this topic is really going to resonate well with a lot of our mental health providers. So please take a couple minutes and tell us all those things.
Yeah, for sure. So we do have a website. It's www.jumpstartpsych.com. You can just click the press start button on the top of the web page to learn more about the Psychotherapy Essentials track and apply for the program. We do also have an Instagram that's at Jumpstart Psych, where we post relevant content and psychotherapy tips and just tell you more about what Jumpstart Psych is all about. Our program does meet 4 times a month. So the Psychotherapy Essentials track covers 5 different types of psychotherapy modalities, and we do so through pre-recorded lectures that feed you the most high yield and practical information that you need for clinical practice. And you practice it in the following 2 sessions per module through an experiential script that you read and we dissect together. And finally, you presenting your own case where we help you learn how to understand and implement the psychotherapy modality we're covering. We do also, in conjunction with that structured curriculum, we do also have group supervision, which is a bit more free-form and less structured for people who just have general questions about private practice and their own well-being, their own personal experiences in psychiatry, doing psychotherapy, talking about different medications that are working or not working, and just getting some peer feedback. And all of that is led by trained psychiatrists. Both Doug and I lead the Psychotherapy Essentials course, and our colleague Gilly Chechel, who's also a psychiatrist who did residency with Doug back in the day, she also leads the supervision sessions as well. If I hadn't said it before, we do cover supportive psychotherapy, motivational interviewing, mindfulness-based techniques, psychodynamic psychotherapy, and cognitive restructuring, which is a cognitive behavioral technique.
Awesome. Lots to learn from your resources. Thank you so much, Dr. Talis, for being with us and for the important work that you're doing. We will include all the websites and everything beneath the description of this video, and can't thank you enough.
Yeah, thank you for having me, Amanda. I also wanted to say that if anyone's interested in scheduling a time to speak with me, I'm also available for that as well, for a free consultation for your private practice needs. So that'll be also in the link attached to the video.
Perfect. Thank you so much.
Take care. Bye.